Welcome back. We're going to talk now about how to apply the epidemiology model and the ABC model and how it's been used in violence prevention work in Ramsey County and around the country, and then talk a little bit about how we have adapted these tools and techniques to a project on creating the next system of health and healthy communities. Donald.
Thank you, Dan. Given the background that we've already talked about, we've done a lot of work in Ramsey County, both to understand the problem of family violence, to really understand where it comes from, and then to work to give people some tools and strategies for how we could all be a part of preventing violence through both individual and system approaches. We started this work pretty broadly a number of years ago and then decided to really focus in on trying to reduce and prevent child abuse and harsh treatment of children. There was a long process that we went through to come to that. That's explained in an article that you can find on the Ramsey County website. And if you go to the Ramsey County website and type in the Wakanhza Project, Wakanheza project, you'll be able to read all about this. I'm going to give you a very, very brief.
Can you spell that again?
Yes, Wakanheza, the Wakanhza Project.
Perfect.
So now that I spelled it, I'll tell you what that word is. Wakanhza is the Dakota word for child, and its English translation is sacred being. And we were given the gift of that word by a woman named Gabrielle Strong, who shared it with us in our community and said that if we were to truly regard and treat our children as Wakanhza, as sacred beings, that we probably wouldn't be worrying about the problem of child abuse because it wouldn't be occurring. It was an incredibly powerful learning. We took the gift and power of that word, combined it with the ideas that we've been talking about here today, the epidemiological approach and the ABCs of communication, and created this thing that is now known as the Wakanhza Project. Its first implementation was actually at the Minnesota Children's Museum here in St. Paul, Minnesota. We were approached by the Children's Museum around the time that we were trying to sort this all out with a question of what they could do to reduce harsh treatment of children in their waiting area while people were waiting in their lobby for tickets. They were seeing a fair number of parents coming into the lobby and getting fairly agitated with their children, and sometimes starting to yell at their children, and sometimes starting to threaten them, and even every once in a while almost hitting their children while they were waiting in line for tickets at the Children's Museum. And they felt pretty powerless to do anything about it because they couldn't really understand why people would come to the museum and act that way. We brought these ideas that we've shared, this whole idea of children being sacred beings, the idea of that we really believe that people tend to act out not their best. We'll even move away from that word violence. We tend to not act our best when we feel overwhelmed by powerlessness and humiliation. Now, if we apply that to going to the Minnesota Children's Museum, what we walked through a process with the staff and leadership at the museum where we identified that instead of thinking about parents as bad people who wrap their children up in the middle of winter and come down to the museum in order to mistreat them, recognize instead that it's actually very challenging to wait in line in a place like a children's museum. And in fact, ironically, it's the place that was probably most designed of anywhere in our state for little children, which actually was helping to cause the problem they were seeing, because the children couldn't wait to get upstairs and go up the magic staircase to play and go and see all the incredible exhibits they have there. While the parents, frankly, if you're a parent, I think you'll understand this, the one thing they want is to be seen as good parents who have well-disciplined children. I do want to just take one moment to share one of the other most important things I ever learned in this area, and it's something about the word discipline. I think when we hear the word discipline, and I know when I became a parent, I thought, well, I need to discipline my child. And in my mind, what that meant was to sometimes punish and to set all these parameters for him and control him. Well, another community leader taught us that the word discipline actually comes from disciple, and it means to teach. Pretty powerful learning.
Yeah.
So as we started thinking about what we could teach both to children and parents as they were waiting in line, the answers started to look very, very different to the museum staff. And just a key thing about community system organizing, we did not tell them what to do. We had no way that we could tell museum staff people how to run their museum, because I don't know about you, Dan, but I've never run a children's museum. But by asking them these questions about why do you think this is happening and what could you do, what's a tangible thing that you could do in the moment to try to reduce this problem that you're seeing, what they figured out was they could have playologists and funstigators go out, and I can't spell those for you, playologists and funstigators who started to go out and play with children while they were waiting in line with their parents. And what was stunning about that was is that the children played with the funstigators and playologists, the parents were able to buy their tickets, they were able to go upstairs, and the problem largely disappeared. And what's amazing about that story is that it didn't cost any money. It didn't involve, revamping the whole structure of the organization. What it involved was revamping the way we thought about parents coming into that museum. Now, I want to give you a very, very different example of that, because that one almost sounds like a gimme. It just sounds too easy, because the Children's Museum is such a nice place. If on one hand you would say Minnesota Children's Museum, if we want to think about a place in the community that's probably most opposite that in many ways, is a domestic violence shelter. And we had the opportunity a little bit after our work with the museum to start working with Women's Advocates Shelter, which is actually the first domestic violence shelter in the country. And what was striking about that was that they were seeing the same kinds of problems. And again, as you think about doing community system organizing work, the key question that we asked at both the Children's Museum and Women's Advocates Shelter, and in all the work that I've been involved with, is, are you seeing problems that seem to be happening on a recurring and predictable basis? If something comes out of the blue, and that again goes back into epidemiology, if something just happens randomly out of the blue, it happens randomly out of the blue. But if you have a bunch of people that go to the same restaurant and eat the same thing and come home and get sick, that's telling you there's something going on in the environment, in the stew that people are eating. So both at the Children's Museum, we asked, what are you seeing happen, and get very specific about the behaviors you're seeing, which led them to come up with playologists and funstigators. In the case of Women's Advocates Shelter, when we asked that question, they immediately could make a list starting with people coming in during intake, often lose it with other people at the shelter, with staff, and with their children. And when we discussed with them, why do you think that might be happening, and moved away from their parents who are stressed, and so of course they're going to do that, to what could you maybe do to change it? They moved from a process, and I'm giving you a very abbreviated version, where they would bring people in, first thing, put them in a little cubicle and give them a stack of 8 forms to fill out, oftentimes with 1, 2, 3, 4, or 5 children crammed in the cubicle with them at arguably one of the worst moments of their lives, to recognizing, well, there are some things we could do. We could tell people welcome and you're safe when they walk in the door. Instead of giving them 8 forms and putting them in a cubicle, we could take them up to their room and get them settled and get them something to eat and tell them a little bit about kind of the life of the shelter and what's going to happen the next few days. And then tell them, instead of, again, giving them 8 forms, tell them, well, there's actually 2 forms that have to get filled out tonight now so that you can stay here. When you're ready, I'll come back to your room and I'll fill out the forms with you. And what's amazing about that story, again, it didn't cost any money. They didn't reconfigure the shelter. And what's also really important that we learned there was this notion of, I think sometimes in places like shelters and in healthcare systems, we get really caught up in we have to be efficient and fast. And what they found was, by doing it this way, by actually helping people fill out the forms, it went faster because people weren't having meltdowns. And that, again, I think is another really nice tangible example of both applying the ideas of epidemiology and the ideas of both people at the shelter, at the museum, and a myriad number of places that we've worked with, that they see it as in their interest to be a part of making a better place for the people that they work with and the people that work there. And we're going to come back and talk about that a little later when we talk about healthcare too.
That's great. Thank you.
Thank you, Dan.
So do you want to talk about healthcare now, or do you want to?
No, I think you're going to talk about next systems, and then we're going to come back and talk about
Well, I'm
healthcare.
struck by the stories because, You know, it reminds me of the difference between change and transformation that this fellow Chris McGough talks about. Change is a fix and it's about the past, but transformation is a creation and it's about what you want to create. But how slowing down and using innovation and creativity and creative thinking, you can really redesign systems in a way that are much more effective, efficient, functional, and satisfying for everybody. And so one of the things the Densford Center is partnering with is the Next System Project, which is a national movement. And what we would like to do is create the next system of health, and healthy community. And so we engaged Donald, along with Vicki O'Day, who is our community organizer with the Next System Project, to sort of talk with people about what are their notions about health. How do you really define that? How do you really become aware of that? These are some things that we got from some small focus groups, and we're going to continue to gather information from the community. Health is, for many people, feeling good, wholesome, belonging, feeling strong and fit, endurance, humor, a sense of calm, no worries, just being. Health is purpose and relationships, comfort, running through a spring meadow, friendship, community, giving and receiving love. Health is the ability to do, to be, the actualization of purpose, breathing, interdependence and interconnectedness, total being, ease of mind. Health is to be joyful, to have balance and thrive with energy to connect to life. Be contagious, go viral with joy. Take time to connect to your own health and the health of our families and communities. And so taking these notions of health and talking with people at the Next System Health Project and the Democracy Collaborative, what would it take really to create and redesign a 21st century healthcare system that would be our next system of health in regards to making a difference and moving beyond the systems that we have today? Many people would say today's is not necessarily a health system, but a disease-oriented system, and it's more about disease management than it is about health promotion. And so the Densford Center is working with the Next System and the Minnesota Next System Project to engage people in the community to talk more about these things and to activate and bring about systems change that would be better for all of us. In a minute, we're going to talk about healthcare providers and what health might mean to them in terms of working in a healthy environment.